Hi everyone. Today we're going to review Chapter 16, Dealing with Problem Situations. And if I could retitle this, I would say What to Do When You're Challenged in Group. Because group is within itself challenging, people are challenging, but problem feels problematic to me. So let's just say that. So one issue that can come up in group is when you have somebody who's a real talker. And I have to say that for the most part, what I see is actually nervousness. And so, especially if somebody starts to sort of bear down in their speech even more while they're talking, that's a good sign to me that this is just an extrovert with anxiety. And again, I cannot emphasize that if you've set up the group in a process in a way that allows for everybody to contribute, you don't often have to cut people off because you've told them you only get 5 minutes or give me feedback in a word or a phrase. So when you provide enough structure, the chronic talker is less of an issue. You might also have a rambler, somebody who just rambles on, pontificates. I can do this at times. And somebody who is a show off. I definitely saw this in some of my IOP groups, sort of younger, usually younger male clients who sort of want to appear, sort of project their a stereotype of maleness sometimes into the group, and it can come off in this way. So ways to help us when we have somebody who really likes to talk a lot. So, first of all, I think, as I said, give structure. So, I've noticed that we've heard from a lot of people who have, really, kindly shared a lot with us the past couple weeks, and I'd like to hear from some members who haven't. So everybody just share a word or a phrase, or you only get 3 minutes, and we're gonna set a timer. And honestly, if somebody's a real talker, I think that's just something you really want to pull that member aside and have a one-on-one so that they don't feel, shame for essentially what they know in terms of how to communicate. And the author also offers some interventions here. So pair them up to give feedback, address group, about sharing time, making sure everybody has enough time to share. And again, thinking about our group rules, right? If somebody's not sort of paying attention to them, then that's another way that you can sort of bring this to light in the group experience. The hardest part about all of this is that the group is going to be looking to you. And so you really have to own yourself as a leader. And even if you don't feel like you kind of embody that or you are that, it is a fake it till you make it. I want you to act like you think a leader would. Because in that case, when people really sense that there's strong leadership, you're less likely to see a lot of acting out. The dominator often wants to control the group situation, but again, I often find that this is related to anxiety, like they're bearing down in their communication style. So it's just something to check in. We're sort of giving voice to what's going on in that moment. So, I just want to know right now, how is everybody perceiving our group process? Is everybody getting a chance to share? Does anybody feel like that they're we're hearing from the same people over and over again? I mean, I just always try to do it in a way that avoids shame. Certainly, it can be a way to distract and and not really engage in work. But again, that might be after, I would say, 1 to 3 sessions. If this behavior keeps coming up and they're kind of not picking up on social cues in the group, because groups will kind of, they give you. You'll in a group that's working well, they'll give the member kind of some shade and just be like, hey, like what's up with this? So if you've established some good norms, then this is less likely to happen. It doesn't mean that it won't happen, that's for sure. And groups can be challenging. So when I get a distractor, I I honestly, okay, so then I try to bring in structure to the group that allows for that not to occur. So if somebody is just constantly talking about, like, I don't know, what they did that weekend, or just like nothing that has to do with the, class or group topic, um, then, I might even point that out, like in the, in the group at that time, like, I'm noticing that you're not really staying on topic about your recovery, your feelings, your, sort of whatever it is. And I'm wondering what that's about. I think it's important to explore because often, when we're working with adults who are coming to outpatient settings, they're tired, they've been working all day. And so it might just be fatigue. And in this case, I'm like, all right, well, then we're going to take a pause. Let's do some movement. Let's do some breath work and come back to this. And then I really want to hear authentically, what's going on in your recovery? How are you supporting yourself today? The rescuer is, offering sympathy rather than empathy. And, they might be like, oh, you're, that's a hard situation. But, you're doing so well. And, I really, see you like smiling in our group, and I feel so good about your progress. And that can kind of shut down the group member to really explore their suffering and their pain. And so, um, again, I try to point it out in a way that's indirect so it doesn't put anybody on the spot. So, I'm wondering, let's pretend John is the rescuer, and I'm sharing a story right now about, let's, um, I'm in recovery from substances. I'm just coming up with this in the moment. So, I'm in recovery from substances. I'm talking about how painful it's been to reconcile with my family members. And, John comes in and says, "Oh, Abby, you're doing such a great job, though. Like, don't worry about it." Something sort of cliche, if you will. And as a group member, I might say, or as the group facilitator, I might say, have y'all sort of like been in these situations in life where, like, you really sort of want to say more about how you're feeling, but you can kind of tell that somebody doesn't really want to go there. And so, they just kind of give you like, oh, you're just doing a good job, or like sort of a little phrase to shut you down. Has anybody ever felt like that before? So I'll bring it into the here and now, but sort of indirectly. Just one way that I deal with it. Negative members. Again, I just, highlighting that people complain to connect. And so, again, I'm cautious about the function of the behavior in the group setting, and what stage of group we're in. But I will switch the way that I might be using language so that I'm focusing more on strengths rather than pathology. So, for example, uh, I'd like to hear one behavior you all did this week that helped to build your resiliency, as opposed to, you know, what was, how did you deal with any, manic episode or depressive episode this week if I'm in a group for individuals with bipolar disorder or something like that. So I'm careful about the language that I'm using as a way to bring the process into a more strength-based way, which, is sometimes just enough to help that person get out of the negative loop. But if it isn't, and they're really seeming like they're, going down the rabbit hole, so to speak, then I'm definitely going to pull them aside. Sometimes that just might mean that that group in particular is not appropriate for them, but it certainly doesn't mean they're not appropriate for group. I think in that case. I've worked with, I ran a group for mothers with depression at one point, and, there were a lot of things that one might label negative, but by going down that rabbit hole, it helped us to understand, sort of the distorted thinking, right? Um, so just look at the function of the behavior before you jump on to, that this person's just negative. You can definitely have resistant members. I mean, even members who really say that they want to be engaged in the group might be resistant, right? Like, I really want to eat healthier, but I'm pretty resistant to it. And so I try to find a place where I can experience empathy and just sort of the universal experience of feeling quote unquote resistant to something, so I can be more compassionate towards that member. And when I'm thinking about this in particular with like court order clients, and I do think it's important to give them some space to discuss, um, what it's like to be forced into therapy. I'm honestly a little. There are pros and cons, and we can talk about this in group. But there are some pros and cons to mandated therapy. So at any rate, I just always focus it on the goal of the group. So I hear, give them a chance to vent, validate it, and then say, uh, well, we're going to do whatever we can through this group experience to make sure you don't end up back here again, because it is really sucks to have your power taken away, and let's sort of explore that a little bit in a way that it supports that person uh, joining and creating greater cohesion. In this situation, it's also really good to get the other group members involved and say, what was it like for everybody to kind of quote unquote be forced to come to therapy, and tell John about those experiences. Let's think of Yalom again, right? The universality and the experience. Get the leader. This doesn't happen too often, but when it does, it really is a pain in the butt. I'm not going to lie, it's challenging. So, you'll have somebody who might want to become the group leader, or, um, you know, I've just also had clients who, because of their traumatic backgrounds, exhibited what one might call manipulative behavior. And so they might be confrontive or challenging or look to sabotage, sort of making inappropriate jokes, or, just everything that I do is just wrong in some way. And in this case, I really do feel like it's important to have a one-on-one connection with that person before they, sort of might subgroup, and it can become insidious and get worse. So it's better to be direct from the beginning and say, what's making this hard, uh, you know, uh, in detail and behaviorally describe what's going on in terms of that client's behavior in the group, and what you see is the outcome of that, right? Help them connect the dots. Not everybody understands that, behaviors that we might, call manipulative are socially unacceptable. That's one of the biggest pieces that I've learned through my practice. And I just, as we're going through all of this, right, it's always about bringing the level down, right? Like getting people grounded. And if you can't get there, if it doesn't look like you're going to get there, you're just going to stop the group, regardless of whether your boss is going to have feels about it or whatever the case may be. If people aren't safe, you just put a halt to it. That's part of our role as being an advocate, as counselors. So what can lead to the get to the leader place? Putting somebody on the spot. I try not to sort of quote unquote call on somebody. I'll say, as you all have seen, is there a brave soul here who would be willing to share? Um, let's see. I mean, some of what they have here fails to deal with members' anti-authority attitude. To some degree, this is true, right? Like I definitely had a supervisor who ignored these kind of behaviors, and man, did they continue, and in a really annoying way. Uh, but again, if you're doing appropriate pre-screening, this won't happen. So there's a lot of different reasons why somebody, might engage in quote unquote get the leader kind of behavior. And the author here has some, just overall like negative attitude, maybe antisocial personality, wants to be in charge. But honestly, what I often find is that it's just that person either doesn't know how to develop trust or they don't trust you. And so this is where it might be important to kind of validate that, yes, the system is, it's flawed and it causes oppression in a lot of different ways, depending on the person's intersectional identity. And, here we are sort of clashing. It's just to say there are a lot of different reasons and whys as to why somebody might have a negative attitude and engage and get the leader behavior. So I often will ask them, like, what do you need to trust me? Like, just start there. But again, if it's really just not, they can't engage in group, they can't engage in group, and that's a reason that they need to leave. Dealing with silence. So silence is healthy. We know this about therapy. And I always do a check-in. I'm always, you'll hear me say, like, does the silence mean that you're understanding what's going on, or that I need to clarify a little bit more? And so, sometimes I'll just to kind of take a read of the room, but especially if I just gave directions or something, then I'll repeat myself and then check in on the silence to see if there are any questions. Sometimes people just need longer times to process. And of course, you can do a round or an activity to get people involved. Sometimes the round is just, how do you get motivated for therapy when you really don't want to do it? One of my favorite ways to end a group is, how can somebody get the most out of this group experience? And so seeing if you can, sort of identify what's going on in the here and now to help the people become more productive, but also honoring silence. Okay, so here's the slide on productive silence. So, I think this is probably the harder part of running a group. It's hard enough not to respond to somebody when they're in silence, when it's one-on-one. It's a totally different thing when there's 10 or 15 people staring back at you. And I think this also is important for you to think about what you're comfortable with. In fact, for all of this, you being the tool, what are you comfortable with, and how are you, comfortable processing what's going on. But definitely, if energy is low, active directive interventions are better, and just something to consider. So it's not uncommon for group members to want to hook up with each other. It's definitely typically not encouraged because, if something, let me give you an example. So like I was running a group where two people got involved with each other, but the one person was married, and so that also brings a whole nother dynamic then into the group process. So it's generally speaking, you'll find that it's not encouraged, and you want to find out, if, how, and why the relationship serves the person's goals for being in the group. Because often the case is that it doesn't serve them, and it's, sort of part of an acting out behavior pattern. Crying, in general is about people healing themselves, and yet sometimes for some people in the group, it can be a way to bring attention to themselves, certainly, depending on their trauma history. And so, if someone is emoting a lot, just in general, we ask them what they might need. And, usually I'll leave a little extra space for group members to validate that person so they don't feel alone. I'll ask if they need anything, and if they feel comfortable to just kind of sit with themselves for a minute, and just to know that it's okay to cry, that that's a healthy sign. But certainly, the more structure you can put around it, the better, because if somebody totally decompensates, they're not going to be able to participate in group. Just, I guess, sort of here, the author continues to reiterate some of what I told you. Somebody's having an intense reaction, or, just needs attention. There's, of course, crying can serve as a function, but, um, just be careful about that. So Definitely, you're going to ask a member to leave if they are negative or hostile. We're just not going to allow anybody to abuse the group. We, of course, are going to try to diffuse and work through the conflicts that are coming up because, people ended up in group for a reason. And so we need to kind of work through some of the trouble spots. And yet we have to be clear about our boundaries because people come to therapy because their boundaries are typically too rigid or too loose. And so it's good for us to role model that, at some point we all have a line to draw. Additionally, it might mean that that person needs individual before they join a group. Absolutely, you want to ask somebody to leave in a one-on-one. You never want to sort of lash out in a group, even if they are, kind of belittling you, because you know that that communication is just reflective of their dysfunction and illness. And so it really has nothing to do with you. That doesn't mean that I'm not affected. Of course I am. I'm still a human being. I'm a sensitive human being. So I'm impacted, but I always say, let's take a smoke break or something, and I want to talk to, A, B, and C about what's going on right now. So this sort of, again, comes back to the group rules, and if you've set a foundation and a boundary around people expressing, homophobic, racist, just any kind of prejudicial response, then people will be mindful of it. And that's not to say that, something still won't come up in the group, but do whatever you can to process what's coming up in the group. And, how does that person that they talk to, how does that sit with them? Get other group members to give them feedback, and just, again, you're going to have very clear boundaries. We're not messing around. But everything through our lens needs to be about a learning opportunity for the client whenever possible. That said, no one is ever allowed to verbally abuse you. And, if they're acting out in that way, it's time to end your work together and let them know that, they can come back to group when they're really ready to participate and work through some of what's coming up in individual first. And while this PowerPoint could be so much longer, I mean, groups are challenging and people come with all different levels of challenge. At the end of the day, if you just a reminder that everybody is coming, with their own assumptions about everybody else, and that if we stay focused on creating a group that's safe, where people feel a sense of belonging, a lot of what's talked about in this PowerPoint won't come up because you'll have already set clear boundaries. But we can also discuss this more in group together because I know this is an area that makes people anxious. And I'm looking forward to connecting with you. Thanks.